Hi everyone, I'm Sarah Borman. I'm the Operations Manager for M3 Health, and I wanted to chat to you today about a full-time team leader position that we have available at our Ascot Vale state-funded GP respiratory clinic. So a little bit about the service itself. So we know that COVID has drastically kind of changed the healthcare landscape. It's put a huge demand on the system over and above what we would typically experience, especially in winter. And it's made the healthcare system more complex and more difficult to navigate. GP clinics or normal GP clinics are not really established with the right levels of infection control protocols to see people who are unwell with respiratory symptoms that may or may not be COVID. And so what we're seeing is that there's this huge cohort of people, but particularly preschool aged kids, that are really struggling to access care at the moment. Even for things like tonsillitis and ear infections, and of course, they are more at risk of influenza. They've not been immunised against COVID yet either. And so what we're seeing is these sorts of presentations that are usually typically quite mild, presenting to places like the Royal Children's Hospital. And you might have seen in the media of late that ED departments are getting overwhelmed with the demand on service. And typically these presentations are right for general practice as long as general practice has the right infection control set up in order to safely see those patients. And most general practices don't have that, which is why the state government got together and they put some funding and they said, okay, we're going to give some funding to some general practices to bolster their infection control and make sure that they're setting up safe environments where these people can access care. And so that's what we did. And this is what the service does. So Ascot Vale is unique again in that it's not also running as a general practice. Its sole purpose is to see patients who are unwell with respiratory symptoms who may or may not be COVID positive. We do not see other general practice presentations at this clinic. So it's very simple in that we're not balancing infection control with well patients, so it has a single purpose. So drastically reduces the complexity. And if you're working in general practice right now, you'll know that it's an incredibly complex environment. The simplest of things are quite difficult at the moment. And so having a single purpose and treating one particular kind of problem, we only see patients face to face. It is a service that has an incredible impact on the community, and it is a fairly straightforward service to run because all of the things are in place to allow us to do that safely. The clinic has been especially designed and set up to see unwell patients. We have HEPA filtration in each of the rooms. We have the rooms of the waiting room and the patient rooms have all been separated, even in terms of partitioning between both. So the air filters have been set up for everything to work the way that it's designed to work. There's red zones where we only clinicians see patients face to face in the highest level of PPE available. And then there's orange zones, which are transitory zones. And then there's green zones, which are completely safe and separate from the other areas in the clinic. And patients do not ever enter those zones in the practice. So it's a fairly simple practice and it's fairly straightforward to run. So that's a little bit about the service itself. Now, a little bit about the role. We're looking for someone who can commit to full-time hours, and especially over winter, there's a huge demand on this service right now. So if you have holidays booked in the next, before September, please don't apply for this position. We're not a huge organisation, and as you will know, in general practice, it's a real struggle to get staff at the moment. So we're not in a position to cover large amounts of annual leave. So we are looking for someone who can commit to full-time hours until at least September. If you've got holidays planned after that, that's okay. We can chat more then. But we're looking for someone who can really commit to this until at least September, and then we can get a little bit of a break. We're looking for someone with experience in general practice as either a practice manager or a senior receptionist, team leader type person. You will be the only person on site who has technical expertise in medical reception. So we have employed doctors and we have a number of registered nurses that take care of the patient side of things, but you'll be responsible for submitting the Medicare claims and managing the administration of the practice, which is drastically reduced because we only do two types of consults. We only do a standard 23 and then the only other item number we deal with is the COVID positive item number. So drastically reduced, but you do need to know your stuff because, as I said, you'll be the only person on site. You will have wider access to the M3 Health team. So if you need to ask something, you can. But typically we find people with experience are more comfortable on site. The computer software that we use is Best Practice. So if you've got experience in Best Practice, that is even better. You need to be super organised and you need to love systems and processes. So we're not looking for mavericks here. There's no opportunity to buzz the tower because this is a high volume, low variability clinic, which means we do one type of consultation again and again and again and again. We see quite a few patients per hour through this clinic. And because of the nature of the work that we do, the processes are designed to keep everybody super safe, right? So you do need to have an affinity for processes and you do need to respect the process that's in place. It's super slick. The clinic's been running since January. We've done lots of iterative changes to the process to make sure that we can safely support a high flow of patients through the clinic. And everything is designed and set up to support that purpose. So we are looking for someone who's super organised and loves systems and processes. This is a picture of the clinic itself. And like I said, its sole purpose is respiratory patients with respiratory conditions. It is funded by the Northwestern Melbourne PHN, but we do also deal with Medicare claims as well for this one presentation, right? So the opening hours of the clinic are 9 a.m. till 7 p.m, 7 days a week. You would be expected to work 5 days a week. There is an opportunity for hybrid work. Not all of the admin work has to be done on site. So we're happy to discuss, there will be times that you need to be on site. So you do need to be within traveling distance of the clinic, but there'll be lots of activities that you can do off site. So things like rostering, reporting for the Northwestern Melbourne PHN, those sorts of things you don't need to be on site for. So it is flexible. We can offer hybrid working solutions to the right person. It's $40 an hour as the base rate. So super annual leave, sick leave, those things are paid on top of $40 an hour, but $40 an hour is the base rate for this position. The activities. So rostering is probably the key one. Just making sure our doctors here are employed. They're not contractors, which is a unique setup. So you do have a little bit more control about when people are working. But yeah, making sure that doctors are in place, nurses are in place. And if we scale to the point where we have more medical receptionists on site, making sure that all of the people are where they need to be and they know their shifts, and that's all of that sort of stuff is locked in. There is some reporting requirements for the Northwestern Melbourne PHN. Most of that stuff is automated. So we track how many patients we see. We track a number of different data points for the PHN. Each week, there's a community of practice session with the Northwestern Melbourne PHN, and that is where all of the other state-funded GP respiratory clinics get together. We share learning, we share knowledge, things like that, and you would be expected to attend those. And basically, the overall objective of this role is the smooth functioning of the clinic. So that's it. If that sounds like you or someone you know, get in contact with me and I would love to have a chat. Thanks.